Straight from the CDC and leading off at 6 o'clock, we are in for, quote, the most difficult time in the public health history of this nation. More than 98,600 COVID-19 patients were in U.S. hospitals Tuesday, the most counted during the pandemic.
And we've just recorded the second highest single-day death toll since the pandemic started. Nearly 2,600 people have lost their lives.
People exposed to the virus should isolate for 10 days. That's down from 14 days. People with a negative test should isolate for only 7 days. We have team coverage tonight at the CDC and all over Atlanta.
We begin with CBS 46's Ashley Thompson. She's live at the CDC to explain when we could see a much anticipated vaccine.
Tracy, the good news is this vaccine is actively being produced. They are developing millions of doses, and as soon as the FDA says go, it will be ready for distribution. The U.S. Department of Health and Human Services hopes to have enough COVID-19 vaccine for every American who wants it by the spring. The first doses ready to be shipped this month if the FDA approves emergency use authorization.
It is not about getting in front of EUA. It's just making sure that we have everything locked so when EUA decision comes, distribution to the American people becomes immediate within 24 hours.
COVID-19 vaccine is currently being produced and stockpiled, ready to go as soon as possible.
Our goal is to distribute within 24 hours after EUA.
According to HHS, the plan is to vaccinate 20 million people this month, 30 million people in January, and 50 million people in February. The CDC has recommended nursing homes and healthcare workers get the vaccine first.
So between December, mid-December, and in February, and end of February, we will have potentially immunized 100 million people, which is really more or less the size of the significant at-risk population, the elderly, the healthcare workers, the first-line workers.
The UK just approved Pfizer's vaccine, with distribution to begin next week.
While the FDA completes its review, the approval of another independent regulatory body should give Americans additional confidence in the quality of such a vaccine.
And although a vaccine is on the way, doctors are, of course, still treating people even now with COVID-19. Today, on today's call, they made a plea to those who've had COVID-19 and recovered in the past 3 months to please donate your plasma to help save someone's life. In DeKalb County, I'm Ashley Thompson, CBS 46 News.